Well, the local economy continued to show signs of stagnation in December 2022. This is indicated in the Composite Leading Business Cycle Indicator for last month of 2022. The South African Reserve Bank released the December BCI, which shows a 2.1% decrease. The Leading Business Cycle Indicator provides early signals of the direction in which a real economic activity is moving in real time. Now, the decrease was broad-based across all 9 available component time series. The largest negative contributors were a decrease in the number of residential building plans approved, as well as a deceleration in the 6-month smooth growth rate of job advertisement space. At the same time, the composite coincide business cycle indicator increased by 0.2% in November due to an increase in retail and new vehicle sales, as well as industrial production. Well, let's take you to the story now. The Health Ministry has briefed the National Council of Provinces on the provision of healthcare services under the theme mitigating the negative impact of load shedding in the provision of healthcare services. Last year, Health Minister Dr Joe Phaahla announced several measures to mitigate the impact of load shedding on healthcare services. Currently, over 30 hospitals are exempt from rolling blackouts. Now, let's get an update. We're now joined via Zoom by Deputy Health Minister Dr Dhlomo. Dr. Dhlomo, good afternoon to you, and thank you so much for joining us.
Good afternoon, ma'am, and good afternoon to your viewers.
Dr. Dhlomo, perhaps let's begin here. The impact of load shedding and of late water shortages, on healthcare system has been very devastating. I mean, if any of the past few months of direct accounts that we've been getting from patients, workers, and civil organizations in various hospitals is anything to go by. How concerned are you with the current state of affairs, particularly as we talk about the impact of load shedding and those water shortages?
Thank you very much, ma'am, for this opportunity. That is why, as early as September last year, there was a team from the Department of Health led by our Director General, Dr. Buthelezi, working with the head of distribution in Eskom to say the frequency of load shedding is not actually able to accommodate us, because the starting point is that we do have generators in all our hospitals, and those generators are to support us as backup in the event there's an electricity trip for 20 minutes, 1 hour, and all that. And those generators are to make sure that we do not lose any patient in theater, in the ICU, and those generators are not meant to support us right through the hospital with the boilers, with the kitchen for 4 hours and 5 hours. And therefore, we are saying the frequency of load shedding has got an impact on the quality of the service that we give. Hence, we started with that process, and therefore we were engaging to say to them, can we be exempted from load shedding? Because, of course, generators are not coping with the demand that is now been created by long hours of load shedding. And two, we did not budget to have a diesel that is 1,000 liters that could hold us for the whole month in the hospital. Suddenly, the demand for diesel from our generators is just 1,000 liters per week. And the frequency of maintenance and the cost of repairs of those issues. So we are happy to report that of the 213 hospitals that we forwarded to Eskom to be exempted, we have only got 76. We wish you can have more. And the challenge that they face in Eskom is that, to make a big example, Khayelitsha Hospital in Western Cape, Polokwane Hospital in Limpopo, you can't exempt them unless you interfere with the same grid that is supporting and supplying the whole community around those two hospitals. So we need to have a cost that is going to come in here to separate those communities from the hospital as a standalone in the grid. And over and above that, there are ongoing discussions with the CSIR as we are looking forward to the announcement by the Minister of Finance tomorrow, borrowing from the State of the Nation address by the President, that there shall be other alternatives, the solar system. We have already considered that as a Department of Health, but you know that a solar system supporting that hospital, that clinic, will be much bigger and more complex than just a household support. But all those are in place, and we are actually hopeful that they will kick in much earlier than we could anticipate. Before June this year, we should be beginning to see solar systems in most and major of our hospitals.
Dr. Dhlomo, even before, we saw load shedding crippling the country, if I can put it that way, over the past couple of years, the healthcare system has been under the spotlight in terms of just various challenges that it's been having. Would you say, those that are criticizing the fact that, the shortage of healthcare workers, the fact that, some of the healthcare systems are not maintained as and when they should be, this is exacerbating what we are currently seeing now as it relates to load shedding, as it relates to the water challenges that most hospitals in this country are experiencing?
Absolutely, you had it, you're correct. Because if you have to actually get more diesel, for example, you are correct, even the COVID came in and was putting its own pressures. We had to deal with the challenges of COVID. But right now, when we are recovering and saying there are certain programs that we did not really focus on so much because of COVID, let's go back and focusing on getting more people tested for TB, for HIV, for diabetes. Now we have got this new pressure that you must budget more for diesel, more for maintenance. So something is going to give in, and you need to employ more to look at. So there's something that's going to give in because there's no new money that has come in to rearrange. It was actually, I was speaking to the members of parliament this morning to say, because of these pressures, no new money, we have to rearrange ourselves and say, what do you do? And in all our annual performance plans that we submitted last year, we did not budget for more diesel. And the other good example, if there are robots, there's a delay on the traffic because of the robots not working because of electricity. There's a delay on patients getting to clinics and hospitals, and therefore a patient that you otherwise would have saved by getting to the clinic, hospital on time is delayed by the load shedding affecting the robots and the traffic and all those issues. So there's a huge impact that comes in here. And those are some of the processes that we're unbudgeted for, and yet we have to make do with the little that we have. Yes, it is actually true that the health system was already under strain in terms of resources, in terms of human resource, but this has added more on the very troubled health system. So that is also being brought in. Of course, we know there are bigger pressures in the whole country, but within our space, we have submitted that. We have made this bet to say, look, a pressure on education. I don't want to make that example frequently, but if you are not providing education with good resources, you may actually get some of the people not performing well as students and probably might have to fail and come back next year. With us in health, we have no such luxury. When we do not provide adequate and optimal health services, people will perish, and we don't have any chance next year to bring them again and say resources have now improved. So we have that pressure across the whole country in terms of health service delivery.
I'd like to stay on that analogy, Dr. Dhlomo, that you made. And as we wrap our interview, you also mentioned, of course, your hopes on tomorrow's budget speech. The reality in this country, and you've touched on it, resources, is that historically, in the healthcare services sector, particularly, there's been a chronic health worker shortage. So if you do get the funding that you so desperately need from tomorrow's budget, will you ensure that at the very least, that this receives the high attention that it deserves? And I'm talking now about the worker shortages currently being experienced.
This again has got its own challenges. Let me give you a scenario. You would probably have to make decisions even there, even if you were to be allocated funds for a worker shortage. You must decide, do I hire one more professional nurse and get that clinic support, or do I hire 4 porters and 4 clerks to make sure that the queues are reduced quickly and people can get their cards, their files quickly in the morning and go to the... So that again, there's a pressure on that, because sometimes you forego employing a doctor and getting 6 porters with that salary. So there are those pressures, because I mean, it's not normal again to go to a clinic and not find a clerk or a porter or a cleaner. So I would not actually be able to say, sure, it will actually improve. It will completely improve and we get better, but there surely will be an improvement in terms of those critical pressures we have. But as I've given you a choice, an example, you have to choose between employing 1 doctor or 7 porters or 7 cleaners, again, because of the budget pressure that might still come in, yes, to support us, but going forward, it probably may just alleviate the pain and the pressure, but may not completely take us out of the crisis that we might be facing.
Dr. Dhlomo, let's leave it there for now. Appreciate your time. Thank you so much for coming to the show.